This program is for men and women aged 50 to 75 who are at average risk for colon cancer and are considering being screened for colon cancer, either for the first time or if they've been screened before. Most people are at average risk, regardless of diet, exercise, and body weight. This program is not for people who have an above-average risk for colon cancer. This includes people who have or had colon cancer, ulcerative colitis, or Crohn's disease, a parent, brother, sister, or child with colon cancer, genetic syndromes that increase the risk of colon cancer, or if a previous screening found potentially precancerous growths. You may want to get a copy of the report from that screening. If any of this applies to you, see your doctor for recommended screening. Also, see your doctor if you've had blood in your bowel movements or an unexplained weight loss of more than 10 pounds, either of which could require attention. Welcome. This program is about using screening tests to help detect colon cancer, which is cancer of the bowel. Screening means checking for possible cancer when you have no symptoms. In this program, you'll meet people who have chosen whether or not to be screened, and some who have tried more than one type of test. There are many choices, and the goal is to help you decide what is right for you. Colon cancer is the second leading cause of cancer deaths in the U.S. In a typical year, more than 50,000 men and women die of colon cancer. So it's something to pay attention to. Doctors and experts recommend regular screening because it reduces the chance of death from colon cancer. However, you still have a choice about whether or not to be screened, and if you want to be screened, you have several options.
The benefit of screening for colon cancer is that it has been shown to reduce the likelihood of dying from colon cancer. By finding cancer early where it can be treated better, patients are likely to live longer. It can also reduce the likelihood of even developing colon cancer by finding the growths called polyps that will lead into cancer.
The most important decision to me to be screened for colon cancer was peace of mind and not to have to worry about that type of cancer.
Some people think that if they have no symptoms or obvious problems, there's no reason to get screened for colon cancer. But colon cancer doesn't always cause symptoms.
You could have something going on inside your body, inside your colon. You could have precancerous growths that you don't even know you have. You could feel 100%.
I was feeling excellent. And it was just a routine test, and I never really thought that anything would be found. I was surprised. And so was my doctor, as a matter of fact. They found several polyps. Some were cancerous and some were not.
The idea of screening for colon cancer is to get tested even though you don't have any symptoms or reason to believe you have cancer. Screening tests can find potential problems before they cause any symptoms. In thinking about getting screened, it helps to understand a little about your colon and how cancer can grow. The digestive system ends in the large intestine, made up of the colon and the rectum. In the lining of the intestine, growths called polyps can form. Most polyps aren't cancerous and won't cause any problems. A few, however, can turn cancerous. This process is generally slow. It usually takes many years for a polyp to become cancerous.
When we screen patients for colon cancer, we're looking either for early stages of cancer itself, or we're looking for polyps, a few of which may develop into cancer later on. Having polyps does not mean you have cancer. In fact, only a very small number of polyps will develop into cancer.
If testing reveals you have a polyp, it will be removed. Removing polyps reduces the chance you'll develop cancer. About 6 in 100 people will get colon cancer in their lifetime. Most people, 94 out of 100, will never get colon cancer.
We can't really predict who will get colon cancer and who won't. In fact, most people won't get it, and screening for them provides them some peace of mind and reassurance that they're fine. For the people who do get colon cancer, screening has been shown to decrease the chance that they may die from that disease.
If we look at 100 people who do not get screened for colon cancer over their lifetime, about 3 of them will die of the disease. On the other hand, if 100 people do get screened over their lifetime, about 1 to 2 out of 100 will die of it. That means that for every 100 people who get screened, about 1 or 2 fewer people will die of colon cancer. They are helped by screening. The potential benefits of colon cancer screening are as good as or better than getting mammograms for breast cancer or PSA tests to check for prostate cancer. Some people decide to be screened because of a personal experience with colon cancer.
I am engaged to somebody who has been battling with colon cancer for 3 years, and so it's a very important topic to me. It hits home, and I don't want to be in the same situation he's in.
For people who develop colon cancer, getting tested does not guarantee they'll be cured, but it can make a big difference in their lives.
When we detected that cancer initially, I had thoughts of being a regular cancer victim and seeing a negative future. But having this procedure, which led to the removal of this cancer, I feel very much at ease and look forward to a few more years.
We spoke with 2 experts who have thought a lot about colon cancer screening. Each expert has made a different personal choice about whether or not to be screened himself. Dr. Michael Berry is Chief of General Internal Medicine at the Massachusetts General Hospital and has done extensive research on screening for cancer. For him, getting tested was the right choice.
I knew my risk of dying of colon cancer was small, but it was still on my mind. And I reasoned that if I started a screening program, I could lower that risk enough that I wouldn't have to worry about it anymore. In fact, I was screened, and it hasn't been on my mind. And one less thing to worry about is a good thing in life from my perspective.
Dr. Dennis Fryback is a professor at the University of Wisconsin Medical School and an expert in medical decisions with a special interest in screening tests for cancer. He chooses not to be screened.
The costs of being screened for colon cancer and the benefits are the things that you have to think about. For me, the benefit's small. I think that there's not much chance of dying from colon cancer, and reducing that small chance to a little smaller chance comes at a price.
Everyone has their own feelings about the advantages and disadvantages of screening. That's why you should play a part in deciding if you want to do it. A lot of people rely on their doctors to bring up the subject of colon cancer testing, but sometimes that doesn't happen. And sometimes people are referred for a particular test without realizing they could have a different one if they preferred. This program will help you learn about your choices and talk to your doctor about them.